Garcia here, one of the sports and cartilage restoration surgeons. Today we're going to show an interesting case. This is a guy that came in, a lot of pain on the inside of his knee, kind of more of a simple complaint, anterior knee pain. Turns out he had a more significant injury. Not only is a big guy, pretty tall and strong, but also the fact that he had a previous ACL and limited meniscus. So the decision was initially to do a meniscus transplant. But we also found out that his alignment was off, and we've seen a number of these testimonials where, again, you have to fix the alignment, especially if it's not good. So we ended up doing an osteotomy and a meniscus transplant, but before we did all that, we found out he had a pretty large cartilage defect, so his complaint was inside of the knee as well as significantly anterior. So we decided to do a MACI, the anterior portion of his knee, also do the osteotomy and do the meniscus transplant, which is a pretty difficult combination, especially given the size and strength of him. And you can see, he had a long road. It took him almost a year or more to recover from this, but he's feeling a lot better than he was before surgery. He's happy with it, and I hope you enjoy the testimonial. Thanks.
Initially, I tore my ACL about 12 years ago or so, and had that repaired, had a second surgery for some cleanup. Knee was okay for about 5 years, but never great. And then it was steadily getting a little worse and worse, and the pain was getting worse, and so I thought I'd come back in. I saw Dr. Garcia initially. There was a little bit of swelling, and so he decided to do some more testing. Turned out the damage was worse than we had thought, and so he came up with a plan, two-surgery plan. First surgery was more of the discovery. In the discovery, found, again, the damage was a little bit worse than we thought, and so he came up with a plan for MACI, high tibial osteotomy, and then meniscus from a cadaver, and that was a big surgery. It wasn't easy. We knew that going into it. So after recovery, I had a rehabilitation plan with physical therapy. So did that a few times a week, and then that progressed into being able to walk, to being able to do like light activities, finally to the point where super happy that I'm able to play indoor soccer, went snowboarding the other weekend, and really happy that I invested in a challenging surgery, but in the long run it's going to be a great investment, and Dr. Garcia was great the whole time. So the surgery and then the recovery wasn't easy. It was not for the faint of heart, but I would do it again. I think it's a short-term investment for long-term health and quality of life, so I'm very happy that I did it.